What does it take to innovate in healthcare?
Well, Mass General Brigham is a large healthcare system based in Boston. Our catchment area is principally through New England. We are the largest academic research enterprise in the U.S. We do just under $2 billion a year in research with 6,000 faculty, most of them appointed at Harvard Medical School. We drive innovation through a number of mechanisms. Our principal focus is discoveries and insights coming out of our large faculty. We have strengthened every key category. So whether it's cancer or neurological treatments for diseases like ALS, emerging insights on Alzheimer's, are all things that our faculty are known for around the world, and we would see that as areas that will see a substantial venture activity. But I think probably the most important thing when working with a healthcare system is to identify and understand as much as possible what the unmet need is. The more the new company is able to demonstrate its effect and its benefit, and let's say dealing with issues like inequities, or its benefit in terms of saving money, I think the more rapidly the technology will be considered, and then in the end, the more quickly it can help patients when it's deployed.
So my name is Carrie Holly. At Optum, I'm a technology fellow where I have a role around emerging technologies and helping the company at large, key executives and business units advance their technology intelligence. Largely that's in artificial intelligence, but also it includes ancillary complementary technologies like graph, ambient, IoT, and other types of technologies. I think the pain points that we see are pretty typical. Everyone's heard about the triple aim, and that's something that we continue to try to do better and get better at. That triple aim in terms of reducing costs, improving patient experience, improving the health of the population. So those three things are continue to be top of mind for us. When I think about digital health, it's a myriad of and a constellation of technologies. I think about wearables. I think about, as I said, contactless sensors. I think about ambient computing. I think about using artificial intelligence. And we also know with emerging, not just emerging, present and emerging technologies like federated learning, we can actually start training models on your local devices or with the benefit of other millions of devices without having your data move to the cloud and perhaps compromising your privacy or your security. So
my name is John Gordon. I am Senior Vice President of Innovation at Commonwealth Care Alliance and Managing Director of Winter Street Ventures, our captive venture investment subsidiary. I think, the next 5 to 10 years in healthcare, I think you're going to see more transition towards health management. You're going to see more sort of continuous monitoring, IoT devices. You're going to see more and more of that sort of stuff. It's going to become more prevalent. You're going to see more people playing in this space that have not traditionally been healthcare providers. Apple's certainly got, all the major tech players have significant ambitions. Everyone's going to try and play on their strengths to get into healthcare, which means more and more power is going to devolve away from the provider. So I think that's going to be one of the biggest things. And you're going to see power shifting away from providers. And even some of that power possibly shifting away from payers too. The incumbents generally will lose power. Patients will have more choices, but they'll probably have even less ability to distinguish about what's good and what's not. And you'll see more automation, more technology coming in. In terms of startups, I think it's looking for those, looking at that broader industry dynamic and seeing where the gaps are. I think these new entrants are less tied to the processes of incumbency as well, and are willing to leapfrog or take new approaches. And I think that's where you have an opportunity to jump in and say, hey, we can fix this thing. Let's work with you on that thing.
Flare Capital is an early stage healthcare tech venture fund. We're based in Boston. We manage about $500 million, solely focused on the transformation of the business of healthcare. The system moving from a fee-for-service model to a fee-for-value model is driving all of the players in the industry to very rapidly innovate. It is a chaotic industry. It is a chaotic time in the industry. But fundamentally, the industry is moving to a value-based model, which is putting real pressure on the incumbents. And so what's interesting is the opportunity for entrepreneurs to build products and serve those executives, those entities, has probably never been more exciting or enticing as it is now. We've identified 5 themes, each of which we think will generate the potential outcomes that I'm talking about of multi-billion-dollar companies. One is around novel care delivery, so care in non-traditional settings, virtual care, remote care. Secondly, we believe the consumerization/retailization of healthcare is very, very important. Our third theme is around payment reform. Really underlying a lot of this innovation is around new payment models, and so how products and services are purchased, reimbursed, we think is very important. And then our last 2 themes, one is around analytics. We just think it's a standalone category. Analytics, AI, machine learning will continue to be very, very important. And then the last theme is around infrastructure.
Techstars is the worldwide network that helps entrepreneurs succeed. There had been a big shift away from what was previously referred to as Digital Health 1.0, which was the attempt to sell products and services around healthcare to patients. The second wave of digital healthcare, which is what I started getting involved with back when I joined Techstars in late 2015, was Digital Health 2.0, which was really focused on providers and payers. Providing technologies that acknowledged that you're not going to disrupt the electronic medical record. Like Epic and Cerner and Allscripts are not going anywhere. So you're going to need to figure out how to play in the work streams that physicians are already using and using the products that they're already using, and acknowledge that you're not going to disrupt the $3 trillion industry overnight. I don't know what healthcare 3.0 is going to be. I do think with some of these emergent products and services like the Apple Watch, like the Oura Ring, and sensors and smart homes, that maybe there is an opportunity to get back into the home, back into the patient's wallet. I think as younger patients are starting to age and they're a little bit more tech experienced, there's some more tolerance to that. But I still think you can't ignore the way that healthcare is paid for and provided for in this country. And it is a complex system that involves your employer, it involves insurers, it involves providers who are still going to be resistant to putting in some new technology. And hopefully it'll involve a lot more government grants and support as well.
My name is David Waxman, and I co-founded the firm 10110 Ventures. We've been doing that here in Los Angeles since 2013. Before that, I was a founder of 3 venture-backed companies. The first one sold to Microsoft, the second one went public and then sold to Earthlink, and the third one is what took me here to LA. What we're really interested in are big industries that are undergoing massive change. And healthcare is one of those industries, but we also focus on logistics and space and other maybe industries that we don't think of all the time, but that touch us every day. Does this person really, really understand the problem that they're trying to solve on, hopefully on some kind of visceral level, like really have experienced it themselves, or just really have done their homework and understand it? Is the industry ready for this kind of change? We look for founders who've shown their ability in the past to take risk and to be successful in whatever they've tried to do. We don't always back multi-time founders, but usually we back people who've made it a long way from wherever they started to wherever they are when they meet us. And we look for founders who have grit, who want who can deal with the adversity of starting a company, because there's lots of it.
So my name is Victor Echevarria. I'm with a firm called Jackson Square Ventures. We're an early stage venture capital firm based in San Francisco. We invest primarily in SaaS and marketplace companies in industries that we would consider non-consensus. Where I think there is a massive gaping hole in today's technology is filling the in-home care gap. And I don't mean in-home care for aging in place or infusions at home. I really do think that there's a number of services and procedures that it doesn't really matter where they happen. I can go get a blood draw at my doctor's office, at a hospital, at LabCorp, at Quest. It doesn't really matter. You just care about having a phlebotomist who knows what they're doing. You can actually bring a lot of that in home. If I visit my primary care physician through Zoom or through Teladoc, I can fundamentally then have them, as a next step, order labs, take vitals, with a wireless blood pressure cuff, have somebody come in and do physical therapy. A lot of that can be done inside my home without me having to go anywhere. So I think there's a pretty big gap in the in-home portion of what the future of medicine looks like. And we'll start to see more startups that are addressing that gap.
My name is Adil Malik. I'm the CEO and one of the co-founders of ClearStep. And so, what ClearStep does at the highest level is makes it really simple and easy for people who are looking for care to get matched into the exact right care for them. And that considers a variety of factors. At minimum, what's clinically relevant, but then also what's nearby and what's in network, what is affordable, what has availability today or tomorrow, to pursue the overall mission of making healthcare easy to access, frictionless, make it really simple to go from, I think I need care to actually getting the right care with full transparency along the way, with as much of a digital experience as possible.
My name's Christine Schindler, and I'm the co-founder and CEO of PathSpot. We make a kiosk-style device that mounts on the wall next to hand-washing sinks in the back of house of restaurants, farms, packaging facilities, cafeterias, really anywhere where food is handled, stored, or served. And right after a team member or employee washes their hands, they put them underneath the device, flip them over, and it instantly pops up on a screen on the unit and says either green, you're all clear, or red, you need to rewash. And it takes less than 2 seconds, and then they can continue on their day knowing that their hands are clean.
My name is Michael Malin. I'm the founder and CEO of Stasislabs, and essentially we're a remote patient monitoring company. We have a hardware and software solution that has all gone through the FDA approval process. And essentially the idea is that we monitor 6 different vital signs of patients, as well as collect other information about how they are doing at the bedside. This can be in the hospital, in an outpatient facility, or in the home. And then we very simply get all of that patient status to our mobile app and our web app that allow nurses and doctors to, in real time, see how their patients are doing, know when an issue might be coming up, and be able to intervene faster than they otherwise would.
My name is Wout. I'm the founder and CEO of Deep6 AI, and we are a healthcare information technology company. What we try to do is basically get life-saving treatments to patients and market faster, and in the process, accelerate innovation in healthcare as a whole. As you may know, every new drug, treatment, or device, right, in our healthcare system has to be tested to make sure that it's safe and that it works before it can go to market. That is through a process called clinical trials, right, where you have like a A/B testing of new treatment. The problem is that this kind of a gatekeeper, which what we do is we have a very different approach. We don't just rely on the structured data, like those limited number of fields that have labels. We can go with all of the notes, all of the unstructured data, like text and stuff in there. And we use NLP to recognize in that text, in the physician's notes that he takes when he interviews a patient, all of the relevant clinical concepts, We can kind of say, what is the chief complaint? What is the diagnosis? What are the symptoms? What are the diagnosis, the prognosis? What are the medications that have been ordered, right? What are the outcomes from those things? We recognize everything that is clinical in there, and also some social determinants and other things, and genomic mutations, everything. And then instead of pushing those into a regular relational database, we represent a patient as a graph. What that means is a patient becomes an n-dimensional or multidimensional vector that has all of those clinical concepts that we pull from all the different records. So it's very complete across all the systems. And it's an ideal SOFA or subject of analysis, because a graph is easy to add data to. All you have to know is have a patient's identity and identifying unique number like an MRN. And then you can add more other source data to it. And what you can see is not only a collection of all those clinical findings that we pulled from the patient notes, you can also see the relationships between them. You can kind of see like how many patients that have A, B, C, and D also have F. And if we see like well, 87% of patients that have A, B, C, and D also have F, we can start doing probabilistic inferences for other patients like it, and can see how long does it take for the first symptoms of F to materialize and stuff. So it gives you way more insight, and it allows you to actually come up with new hypotheses. And that's something that's much harder to do with traditional software.
My name is Bettina Hein. I'm the founder and CEO of Julie. We are a digital health company that helps people manage their chronic conditions and helps them feel better. There's a real pain point for people that have complex chronic conditions. Oftentimes, it takes years to get the right diagnosis and then to get somebody into a stable condition. And what I realized going through my own chronic condition health journey is that we collect lots and lots of data about ourselves every single day. We have our step counter, we have our digital scale, we have the weather, we have what we're doing with social media usage, we have our electronic health record, but nobody really brings all of that together and looks at it under the lens of the exact condition that you have and under the lens of who you are as a person, not how the general population works in regards to that condition.
The founders and president of Rubicon Md. Basically what Rubicon Md does is that we connect primary care clinicians and specialists for remote consults. It's not to the patient, it's not direct patient telemedicine, it's clinician to clinician, right? So whenever a primary care clinician has seen a patient in the clinic and they have a question that they would like to ask, they access our platform, they provide a brief description, they choose a specialty, and that is sent to one of the specialists that we have on our platform, and they will review that and respond back to the PCP with their impressions and recommendations, typically in a few hours. And that input helps the primary care clinician make a much more informed decision around diagnosis, treatment, and next steps for their patients. If you're uninsured, if you're Medicaid, if you live in a rural area, it's very hard to go see a specialist. So we have a system that's very costly, very inefficient, fails to provide access, and that means a lot of the burden falls on the shoulders of primary care clinicians. And we decided to build a tool to supercharge primary care clinicians and help them drive more value in primary care, better outcomes, and make the system more efficient. And obviously there is a very direct patient impact where patients not only get access to the right care plan much sooner, but they also avoid all the inconvenience and potential complications.